If you can imagine what your health care is today, it would be exactly the same forever without basic research. It is basic research and biomedical research that gives us the advances to understand new approaches, new therapies, and new drugs. My laboratory works on the thrombospondins, which is a family of extracellular matrix proteins. If one thinks about a building being constructed, the iron I-beams might be like a collagen fibril within the skin or in other tissues. And the thrombospondins might be like the workers that come and assemble those collagen fibrils or those I-beams in a specific way. And then they're also important when the tissue needs to be repaired. So you might think that if there was an injury or damage to the building, the workers would come and they would put up a scaffold, and the thrombospondins kind of function to help build that scaffold, help guide the tissue. We've been funded for the last 30 years by the National Institutes of Health, and we currently had a grant that was running for 15 years, but those funds wouldn't begin for quite some time. And so I was delighted to learn that we would have the opportunity to have some support from the Recovery Act, because it helped us to purchase equipment. It also enabled me to retain a postdoctoral fellow whose funding had run out from another mechanism. When people talk about going from the bench to the bedside, it's a very tedious, very complicated process that involves a lot of basic science. Thrombospondins are important for angiogenesis, this process where new blood vessels are generated from existing blood vessels, which is very important for tumor progression and metastasis. It's also then involved or very important for the tissue remodeling after a heart attack. So that, as you can imagine, the collagen fibrils and the tissue has been injured as a result of a lack of blood supply. A recovery process begins that involves the recruitment of immune cells and other cells, and the thrombospondins seem to play an important role in this process. And the Recovery Act really gives us the opportunity to kind of push this project forward in multiple directions.